I'm Dr. John Jester. I'm a radiologist and from one of the group that provides services at Future Diagnostics Group and other places in the South and West Chicago suburbs. And we pride ourselves in trying to do the best work, keeping the patient's best interests in mind. Went to college at a little place called Stanford out in California. Came back to the Midwest Medical School at Creighton because I grew up in the middle of Nebraska. My residency was here at the University of Chicago. I'm a general radiologist, which means I do everything except no longer any interventional or heavy interventional procedures. But the things I really enjoy is MRI and then some ultrasound and breast imaging. How did I choose radiology? Probably by a mistake, but a good mistake, because radiology has changed dramatically in the years I've been in it. Back then it was basically a 9-to-5 job. Today we're actively involved in all sorts of parts of patient care, including doing procedures on patients, and it's evolved into something that I really enjoy. What do we like to do outside of working? Well, our daughter now has 3 little ones, and so we enjoy seeing them. We enjoy traveling. My wife loves to cook, so I'm the dishwasher, but I think I benefit most because if I do that, then I get some wonderful meals on a continuing basis. One disease, there's so many of them, but today our focus is on, and a lot of our imaging revolves around breast cancer, and it can be a devastating disease. I think that would be, and it does affect a lot of people. So I think both curing the disease, but we know that one of the best things we can do for that is surveillance and catch it early. So that's where I focus my efforts today. What's my favorite modality? We have a lot of modalities. We do CAT scans, X-rays, ultrasound, MRI, PET scans. My favorite, because I didn't train in it, I think is MRI, but I do enjoy all of them. I left out mammography and so forth, but I'd still go with MRI. What do I like about interventional radiology? I still do light interventional radiology, meaning superficial biopsies, breast biopsies, and so forth. The heavy interventional radiology really evolved after my training, and what it is able to do, it allows radiologists to see things and treat small things through just a little nick in the skin as opposed to major surgery. So it's brought a lot of advances over the last 20 years. What are the benefits to outpatient radiology centers versus the hospital? First of all, make sure your outpatient center, if you go to it, has all the good equipment and good radiologists. That's very important. Hospitals usually do as well, but if those things being equal, and we do everything we can to make sure FDG has standards at or above the hospitals, the ability to walk in the front door, be 50 feet from the front door as opposed to a 30-minute walk from a parking lot and so forth is one of the things. What's the greatest benefit for ordering physicians? Ordering physicians virtually all want to do the best for the patient, have the best experience. And the well-run outpatient centers will provide a good, potentially even better experience for the patient because they don't have to juggle, don't have the challenges of juggling inpatients and emergency room patients. And so that can mean a better experience for the patient and sometimes quicker turnaround to get the results. When do we interact with the referring physicians? Whenever they need. If they have questions about what to order, they will call us. If they have questions about a report, they'll call us. If we find things that are unexpected, we will call them. So we do our best to interact when needed, but not to be annoying because the referring physicians are almost universally very busy, and so we try to create and be available for the interaction when needed. I wouldn't use the word important, I'd use the word vital, because they need to trust us and understand that we're not perfect, but we are doing our best for their patients and to get the results to them.